So here's a good one. As I'm just reading here, this is a really good one to talk about because you mentioned that sedentary piece about, and you specifically said not watching TV. So someone had a question about TV's effect on cognition and why TV is not one of those things that you recommend.
So TV typically, I think there's a lot of nuances in types of programs that aren't necessarily reflected in the research. So, if you're watching documentaries and things where you're actively engaged, that's going to be different. As a whole, the majority of the population in the U.S. is not watching those types of programs and are more, TV is more of a passive cognitive activity. It's one where you're entertained without having to put forth a lot of effort, as opposed to, when you're reading, you're kind of having to imagine the story yourself. So it's a level of depth of processing and how much cognitively you're engaged.
Here's one that talks a little bit more about the basic science behind Alzheimer's disease. So how sure are we that plaques and tangles are the right target?
I think that I will say that that's not my specific area of expertise. However, certainly there's a lot of alternate theories for other pathways. Mm-hmm. There's a lot of data that's suggestive that the plaques and tangles they're definitely correlated with symptom progression. Whether or not that's the initial, whether or not that's the right target or the initial instigator of the disease process, I think is an active area of investigation. And certainly novel treatments are in the pipeline for clinical trials.
Yeah, and I think from what we're learning and reading about more at the association as well is that it's not probably going to end up being just one thing,
exactly.
Right? It's going to be more like
a cocktail
of treatments that attack different parts of the brain. The more we're learning, right?
Right.
So here's an easy one for you, hopefully. What's a substitute for chicken in the MIND diet? We have someone allergic to chicken, which must be fun at weddings, because that's like all they ever serve at weddings.
My slides aren't there anymore. So the one thing about the MIND diet, again, it's very forgiving. So if you don't need to necessarily, like you notice on that sheet, if you're looking at the slide, you get a point if you have exactly 1 glass of wine. Well, if you don't drink, it's a forgiving diet. You want to kind of hit all of your basics. So fish would be a great alternate. I think you want to, if you're adhering to the MIND diet, which again has not gone through clinical trials, so I don't necessarily advise upheaving your entire way of eating based off of that literature yet. But fish or legumes, non-meat products are emphasized as well.
So one of the other things you talked to, in regards to reducing risks, right? We're talking about, but what about exercise once the cognition deficits have started to show? Is there still a benefit for people to exercise even once they're diagnosed with even MCI or Alzheimer's disease?
Right. So. I think that's one of the, I spend a lot of time talking about exercise because that's one of the strongest areas that has support for influencing cognition at every stage of the disease. So even in the face of an actual diagnosis of dementia, walking not even that much was a stabilizing factor for people in terms of the progression of the disease.
Would you be okay talking a little bit about sleep? So this question is about whether or not if someone's getting a good night's sleep, should they be avoiding their loved one taking naps during the day?
Should they be?
Are naps still okay?
Oh, so Naps are problematic for several reasons. In general, if you're napping less than 30 minutes a day, that's probably, probably an okay thing to do if it's not interfering with your sleep. However, they can also kind of get you off schedule, but it's really an individual kind of process. I'd say for the bulk of people, I would advise against napping, and I've included some strategies for sleep hygiene in those slides, and in essence, the biggest things that you want to think about in terms of sleep is going to bed at the same time and waking up at the same time every day, and not staying in the bed if you're not asleep, and not doing anything in your bed except reserving your bed for intimacy and sleep, and not, don't read in your bed, don't watch TV in your bed.
Yeah, and I think that idea of a consistent routine pattern for people to allow them to get the most rest is so vital. It's such an important thing. So I'm really glad that you mentioned that. One of the other questions was around when you talked about purpose in life, are you talking about their current purpose or past purpose? So this person was asking if they feel currently like giving up, even though their prior life was very purposeful, where do they fit in that category?
So for that specific study, they asked people at the beginning of study entry about how much they identified with having a purpose in life and a meaningful life. So that was really at the beginning of the study, and then they did not look at changes in meaning of in purpose. So I would say, on the whole, if you've across your life have felt like you've had a lot of purpose and meaning, and you can look back and say, I've led a good life, that's probably going to be more in the category of protective. Mm-hmm. But I think that's an area where it's never too late to find meaning and purpose. Sometimes in the face of all sorts of chronic illnesses, it can challenge us to find a different source of meaning when we've kind of set up our whole life with one way of attaching meaning. But I would encourage people to take advantage of that finding to really seek for other ways to find meaning.
So there was one question I'm really glad that this was talked about a little bit, because we've talked a lot and we've heard a lot, especially in the last several years, about risk reduction and what we can do if you exercise and stay active. And we do know plenty of people who have done all those things and still develop Alzheimer's disease. So could you talk a little bit about the difference between risk reduction and what we know about the disease itself?
Well, and I think that I think there's a fine line when it comes to lifestyle factors, and I think this applies both in the context of Alzheimer's disease as well as other illnesses such as cancer and in general. These are based off of group data, so we can never fully apply what we know about groups to the individual. So the general recommendations come from what we know, what helps the population as a whole, but each individual has their own biology, their own genetic, their own interplay between their genes and their environment. And so it's impossible to know for that individual which combination of lifestyle factors is most effective. And certainly the disease progression can trump all for some people, but we do know that we don't fully understand why some people can have a brain riddled with disease pathology and still function very well. These lifestyle factors explains a little bit more of the piece of the pie. They're not the rest of the pie. So we're still working at finding out what the rest of the pie is. So I think the best way to use these lifestyle factors is to have a sense of empowerment, but not to beat oneself up over them. They're, you know, I mean, it's the same story for cancer, right? You want to stay positive, you want to stay, you want to do all these things, but if for some reason you can't, they're not another, it's not another hammer to beat yourself over the head with.
Yeah, and I think we hear that all the time too, that there's plenty of people that have done all the right things and lived those healthy lives, and there's just so much still we don't know about the disease, and why research and funding for research continues to be so critical, so that we can find that what is that one piece that's going to help us get an effective treatment for everybody, not just reducing the potential.
And different people have different, I mean, just as one example that we did not get into today, but the role of, this audience may be well aware of a genetic susceptibility, ApoE4. It's an allele. It doesn't make you have Alzheimer's disease or not, but it can influence the rate of progression of symptoms. And so that's just one factor that can kind of interplay. However, I would say that in general, actually, for people who have ApoE positive alleles, these lifestyle factors actually make more of a difference, not less. Mm-hmm. So, but that just is to highlight that it's just very complicated, and at a research level, we have to work with groups, and at a clinical level, we kind of have to work at an individual, treat each person as their own experiment and see what works best for that person.
So you talked a lot about or a little bit about the different diets and the eating right part of reduction of risk. And this question is about, with such the high correlation between cardio health and brain health, what about those cardiovascular diets, those health recommendations? What do you think about those?
So, in general, I mean, again, it's going to depend on what you as an individual come to the table with. The thing about, like, for example, the DASH diet, it is emphasizing very low-fat diets. We know our brain needs fat. Our brain really, a lot of the cell structure in the brain is from fat, and so if a person has a lot of cardiovascular risk factors, that might be the most appropriate diet for them. But as a brain healthy diet, mm-hmm. it's missing a lot of ingredients that we know are critical to brain functioning.
One of the questions is just a clarification. When you talked about cognitive decline and you talked about the high and low pathology, they want to know what you meant by pathology.
Okay, so yeah, so when brains are autopsied, they look for the signs of disease. So pathology is just another word for the disease underlying it. So that might, but it's not specific to Alzheimer's. So they look for signs of Alzheimer's disease, they look for signs of stroke or infarct, they look for signs of all the different brain pathologies, and then they essentially sum it all up together and say one of the groups had a lot of brain pathology in their brains, and the other group had very little pathology in their brains.
So this is like the most high stress pressure job of the day, because you can see the stack that's still left, and I just got the 1 minute warning. And so I'm going to end with my last question, and know that we're going to try and answer these questions for you about stress and how management on stress plays a part in either cognitive decline or even speaking to caregivers. Can you sort of end us with a little note about stress?
Absolutely. So so I was mostly sticking with the positives, but there's a whole lot of things I didn't talk about that are kind of reducing the negatives. So we know depression accelerates cognitive decline, and related to that stress, stress can certainly increase certain hormones in our brain, and in the immediacy, stress can take a lot of cognitive factors offline, and it can influence our brains both in that moment of stress, and we also know that that the physiological manifestations of stress can have a long-term impact on brain structure. So that hippocampus that I was talking about, chronic stress can reduce even when we don't have Alzheimer's disease in our brains, chronic stress impairs that brain region's ability to regenerate new neurons. So people who have had extreme levels of stress in their lives do have smaller brain regions related to that. And certainly we know that caregivers are chronically stressed and are themselves at higher risk for future cognitive decline later on. So that's a particularly important topic, I think.
Absolutely, and I think a great point to end on as we start to go through the day on sharing some ways to decrease your stress and to take care of yourself a little bit more. If you would all join me in thanking Dr. Marreiro for her wonderful presentation.